So, morning everybody. I'm here today to give you a national perspective on delivering system transformation for better, more sustainable care. So in the next 10 minutes or so, I plan to answer three questions. Firstly, what are we trying to achieve as we think about health systems in this country? Secondly, how are we trying to transform health systems, and what is the role of STPs and ACSs in enabling this transformation? And third, where are we on our transformation journey? And what are we practically doing at the national level to help drive progress? So the first question, what are we trying to achieve? I think it's really important to reflect on why we're taking action at the system level before we move into the various three-letter acronyms that are rather infamous now. I believe what we are collectively trying to do, nationally and locally, is to deliver the best care we possibly can for the populations that we serve, ultimately to improve their health and well-being. My colleagues earlier have touched upon the gaps that the five-year forward view outlined in terms of health care and money, but what does that actually mean, better care? Well, for me, it means that care is focused on people and what they actually need, not on what organisations can or want to provide, and that care is focused increasingly earlier in the disease journey, less in the hospital, more in the community, and more targeted to prevention. That's our ambition. As we discuss things at the system level, we need to remember that if we're not changing what's happening for the people we serve, then there's little point in anything that we're doing. That's all very well, but how are we going to achieve this? And that's essentially my second question. How are we transforming health systems, and what is the role of STPs and ACSs in enabling this transformation? To change the way that care is delivered, we've done a number of things, including the acronyms I mentioned earlier, but the important thing is that the end goal is the same. Our journey started with the New Care Models programme, through which vanguards, including those in this particular footprint, have been exploring new ways of delivering integrated care and population health approaches. However, several of the challenges we face are systemic. We therefore need to forge partnerships that are capable of addressing system-wide problems. We believe that the next phase of this work requires us to build on the New Care Model programme and the work that we are doing at the organisational level, and to work at the system level. That's what STPs are, a vehicle to allow system-level collaboration to facilitate the delivery of better care for the money that we have. They are an enabler, a means to an end. It's important to add that they don't remove the need to work at the organisational level. It will continue to make sense to optimise processes within hospitals, for example, though a common approach across an STP is not a bad idea. They are complementary and not an alternative to organisational accountability. As Ruth mentioned, we know that STPs started off their life in a pretty complex environment and had to make fast progress in coming together and developing system-level plans. It hasn't been an easy process, but looking back, it was an impressive thing to have done. And arguably, it's the P in partnership that's been just as, if not more important than the P in plan. STPs are already strengthening cross-system working and decision-making. And as Glenn mentioned, it's really got people communicating and talking and got the conversations off the ground. A lot of progress has been made, and it's great to see that progress acknowledged at events like today. Most systems tell us that system working has moved on by light years. Over time, we need STPs to be more and more load-bearing. As well as being vehicles for collaborative conversations, they need to enable real change on the ground. So that brings me to accountable care systems, or ACSs. What is an ACS? How would a system become an ACS? And why become an ACS? Well, an ACS is an evolved version of an STP, or part of an STP, in which organisations go beyond creating systems and take on collective responsibility for managing performance, living within a system-level budget, integrating services, and applying valid population health management approaches. It's important to say that STPs, and for that matter, the other way around, let me start that again. It's important to say that ACSs, and for that matter STPs, don't all need to look the same. And it's likely there will be a number of different archetypes. For example, ACSs are coterminous with whole STPs in one model, while in others, they occupy smaller footprints. And I think this links to the concentric circles that Paul mentioned earlier in terms of what the plans are for Kent and Medway. ACSs at the sub-STP level are fine in principle, as long as the ACS makes sense for the whole STP and there is a clear operating model between the two in terms of where decisions are made. Like STPs, ACSs are again a means to an end. They are facilitators of system-level working, which in turn helps, or so we hope, with the delivery of our ultimate ambition of better, more sustainable care. They're not, and it's crucial that they don't become, complex and convoluted ways of getting us to obsess about governance. Systems aspiring to become an ACS will need to demonstrate solid progress in 5 key areas, and I'll talk through each of these in turn. First, a coherent and defined population, a meaningful geographic footprint that respects patient flows of at least around 500,000. Second, a track record of delivering existing care in terms of constitutional standards and progress in delivering the 5-year forward view next steps, thereby demonstrating that the system gets things done. Third, redesign of how care is delivered, a commitment to population health approaches and persuasive plans for integrating providers vertically and collaborating horizontally. Fourth, strong financial management, the ability to deliver financial balance across the system, as well as willingness to take on a shared system control total. And finally, effective leadership and relationships across the NHS and local government as the bedrock of the ACS. So these are some of the things prospective ACSs will need to be able to do. But why would a system want to become an ACS? Well, first and most importantly, because we believe it's by working closely together as a system that you'll be able to transform the care for the people that you serve. Secondly, because taking collective responsibility means we are able to give systems support, freedom, and flexibilities that will enable them to go further and faster than would otherwise be the case. Key examples of this include the opportunity to influence, co-produce, and pilot cutting-edge policy, devolved transformation funding, and streamlined regulation. And I think this latter point is quite important. We're asking STPs and ACSs to think and act like systems rather than individual organisations. So we accept that the way in which NHS England and NHS Improvement need to work together should change to reflect this too. This includes us operating in a joined-up way from a system perspective, providing a shared steer, and also in terms of better working through our regional teams. So I'll quickly run through my final question, which is, where are we now and what are we doing practically to drive progress? We're running an ACS development programme, and we have 10 ACSs, including 2 DEBO areas that we announced at Expo in June. We've worked with the group to co-design a support package that helps ACSs to deliver the commitments of their MOUs. These encompass both clinical and technical work streams. We're problem-solving at pace on a range of matters and developing solutions to the barriers and the issues that we come up against. In parallel to supporting the current wave of ACSs, we are looking to identify additional ACSs in a second wave of the programme, hopefully by January. The process for selecting ACSs is led by our regional teams, and prospective systems will be nominated by them to develop an expression of interest that meets the 5 criteria I talked through earlier. For successful systems that meet those criteria, we believe that moving towards becoming an ACS is the natural next step. However, we recognise that systems are starting from different places and have different challenges. Therefore, the path towards becoming an ACS is neither linear nor homogeneous, and we should support all STPs to build on their strengths. So, to conclude, our ambition is to deliver the 5-year forward view next steps and the best care that we can for the money that we have. We aim to get there by working at a system level, beyond organisational silos, using STPs and ACSs as key vehicles. We've launched the first wave of the ACS programme, with wave 2 to follow early next year. And for successful STPs that meet those 5 criteria, we believe that moving towards becoming an ACS is the natural next step. Thank you.